How can individuals be confident that the diagnosis is correct, considering the overlapping of many mental health issues?
Yeah. So there's some subjectivity about psychiatry in general. ADHD stacks up pretty well as a disorder. There's strong family influence, genetics and things, and associated with good treatment response to various medicines and things. But it is often entangled, like you were saying before, lots and lots of things going on, and it's really important to get a careful and comprehensive assessment with somebody, and to feel heard and understood, that people kind of get you, and that the explanation kind of makes sense to you. Like sometimes you get an explanation, you think, that's not right, but sometimes it kind of fits, and good clinicians will check that out with you. But some clinicians will vary, so if I think something's going on and then I get another opinion from somebody, often it's the same opinion. People will say, yeah, that was pretty accurate. But occasionally you'll get someone saying, look, I see that quite differently. I think autism is much more important, or I really think that depression came first, and ADHD is only, it's only a sort of additional factor with the depression rather than being a disorder itself, or something else. But I think starting with a careful assessment that kind of weighs everything up and looks at the timing of things, like what happened first and what led to what, and then hopefully the clinician can put it in a nice package that kind of makes it less tangled up and makes some sense of it. I think that's kind of, that's the ideal, but there's a little bit of subjectivity with things.
There's a strong genetic link though, isn't there, with
there
ADHD?
Is, yeah, very
so
strong.
If it's in the family, it's
it's not always in families, but we think genetics, explain about 3/4 of your chances of having ADHD in general. And the other things that are involved in ADHD are often early life experiences, like being born premature or needing a lot of resuscitation at birth, or kind of early things. Sometimes though, like somebody might have a combination of things going on, and I might not be that sure about what I think the main thing is. And sometimes we will treat what we think is the most significant issue first, and then see, well, treating the ADHD, does that improve the depression? Or treating the depression, did that improve the ADHD? And then have another look down the track. So sometimes you just got to take a little bit of a wait and see approach.
Yeah.
Yeah.
And that was your journey, wasn't it?
Yeah.
What helped for me?
Initially, we tried treating the ADHD with stimulants, and that made the depression worse.
Yeah.
So the stimulants were stopped, and then SSRI, antidepressant, and that helped. And then we went back to try the stimulants about a year later, and that helped. She's taking dexamphetamine, and just very low dose, and that just so that sorts her. But we're an ADHD family, and everyone in my family that has ADHD, there's 4 out of 7 of us, take a different form of medication.
Really?
Yeah. So,
sounds complicated.
Yeah, it is. Yeah. So it's very individual on what works.
Yeah. And sometimes it's trial and error.
Yes,
it just takes a wee while
definitely.
to work through things.
Yeah. So she had tried a few things, but that seems to be what works.
Yeah, and that can be frustrating too, trying something and then,
Yeah. And it may change as she gets older, and that's okay too.
Yeah, there's an application to pharmac also for lisdexamphetamine, which is a long-acting form of dexamphetamine, which we're kind of hoping gets approved. We're probably going to hear about that fairly soon. I think it comes off patent maybe next year.
Right.
So that will make it more attractive to pharmac.
Because there's a lot of negative side effects, obviously, with the stimulants, and that's probably, you know, as a parent, and from what I know of other parents, that's always the first concern. You know, they don't eat, they don't sleep, you know, and all of those things seem to be quite massive. And it seems to increase anxiety in my children.
You can do.
Yeah,
so, not always.
Yeah, and so I think it's good that there's other options and we can try different things. And,